According to the American Heart Association, every year some 700,000 Americans suffer a stroke. It is the third leading cause of death in the U.S. Every 3 to 4 minutes, somebody has a stroke and dies from the stroke. Joining me now to talk about strokes and stroke prevention is Kristin Pickerell, who is the nurse manager of the Neuro ICU at Norton Hospital and also the leader of the stroke team. Tell us about how you would recognize a stroke.
Well, we tell people to act fast, and what that means, FAST stands for F is face. If you notice any asymmetry in someone's face, if their smile is crooked, that's a sign of a stroke. A stands for arms. You have the person hold their hands out, and if one arm drifts down lower than the other, that's another sign of stroke. S stands for speech. If their speech is slurred or they have trouble saying certain phrases, that's a sign of stroke. And T stands for time. If you're having a stroke, get to the emergency room or call 911 quickly.
Why is time so important?
Well, time means brain. So if you get to the hospital or call 911 very quickly, that means that you have a bigger chance of surviving a stroke. Do you know that stroke is the #1 leading cause of disability in the United States?
Wow. So it's important to get to the hospital fast.
Very important.
Because time saved is brain saved.
Yes.
Why is it important to go to a certified stroke center like those offered at Norton Healthcare?
Well, we're very fortunate at Norton Healthcare to have facilities that are certified through the Joint Commission to provide stroke care, which means that we have specially trained physicians and nurses that do excellent care for stroke patients.
So it's important to get this information down because, again, it could save a life.
Yes, it could.
Right. Kristin Pickerell, we thank you for your help. And if you want to maybe take a stroke risk assessment test, you can go to nortonhealthcare.com/stroke and do that to find out how you're doing. For Get Healthy, I'm Jackie Hayes.